My name is Taiwo Alawode. I am the team lead for NACI, and I'm really excited to have you all on board. I would be giving a brief introduction of what AMR is all about, and then I'll talk about One Health and antimicrobial stewardship. Can you tell me, what are some of the myths about antibiotics that you've heard of, or you've had at the back of your mind, or you'd like to share? Okay, so someone said long exposure to antibiotics causes resistance. Antibiotics is a miraculous drug that treats all infections. Antibiotics can be taken without prescription. Yeah, those are really some great points. You've all said the right thing, and I just want to list some of them out. I don't know if you've had people say things like, oh, antibiotics could help you to cure your infection faster. If you have an infection, just go use antibiotics. And during COVID-19, I don't know if anybody had that experience when people were using antibiotics and they'd be like, oh, it's going to help prevent them from having COVID, or antibiotics is good for treating COVID. Some are those of the myths that we have about antibiotics. Then another myth that we have is that antibiotics has no side effects. There's no drug without side effects, and antibiotics is also one of those drugs. So every drug has a side effect, including antibiotics. Then another set of myths is that antibiotics can help you to boost your immune system. This is very false. And this is why we have some farmers, like some of our farmers here, that use antibiotics on their farm animals because they believe, oh, it would help them to promote the growth of the farm animals. These are all myths of antibiotics. Then some other people also believe that, oh, antibiotics should be stopped when you are feeling better. If your doctor prescribes an antibiotic for you, you should just stop taking it once you are feeling better. These are all myths about antibiotics. And we will be addressing some of these myths as we go along through the course of this training. Then if you look at this slide, can anyone tell me what this slide is all about?
Which side are you on? So the red side is the red guy pulling is a side of tablet, a drug tablet, while the blue guy pulling is injection in form of IVF or injection infusion.
Thank you very much for that. Dauda, yeah, please go ahead.
Okay, thank you very much. I think this illustration is very, very explanatory. We have red and blue side. The red side is the drivers of antimicrobial resistance, which is people using antibiotics, consuming antibiotics like candies. I think that's what the lady, I assume, with the white mouth and different pills of antibiotics illustrates. And the first image with pigs and cows is showing illicit use of antibiotics in cattle, poultry, and likes like that. And the last one, I think that might want to show improper usage of antibiotics and also lack of water, sanitation, hygiene. So this red side is showing the drivers of antimicrobial resistance, while the blue side is saying that vaccination, proper water, sanitation, hygiene, I think those are the appliances for their PEs, and there are things that you can use to prevent yourself from infections. And the last illustration here, it's probably antibiotics in a riot or campaign saying that they don't cure cold. So I think the blue one is they are the preventors of antimicrobial resistance, while the red one are the drivers for antimicrobial resistance. So for me, I am on the blue side. Thank you very much.
Thank you very much. That was excellent. Thank you. Okay, so Dauda has actually explained everything I wanted to explain about the red side and the blue side. And just to reiterate, the red side is showing how antimicrobial resistance is being spurred, factors that are kind of promoting antimicrobial resistance. As you can see, this woman, she's trying to misuse antibiotics or overuse antibiotics. This other person is trying to dispose antibiotics improperly into the toilet. And then you could see this farmer trying to feed their flocks with antibiotics, maybe for several reasons, maybe to kind of help promote the growth and so on and so forth. But if you look at the blue side, this is preventive measures or control against antibiotics. For instance, you can see the awareness placard says, I don't cure the cold, so don't use antibiotics to cure cold. Don't use me to cure cough, for instance. So this is like an awareness program that's telling people what you shouldn't use antibiotics for. And then this is vaccination to even prevent the infection in the first place, so that you don't even need antibiotics. And then the slide at the upper right is showing us the various IPC measures, infection prevention and control measures, like hand washing, wearing of nose masks, using of disinfectant on surfaces, just to help in preventing the spread of antimicrobial resistance infections. So the question now is, which side are you on? I know a lot of people say, oh, I'm on the blue side, but if you ask yourself deeply in the actions you take, do you take antibiotics indiscriminately? How do you dispose your antibiotics? And so on and so forth. That would tell us which side you are on, not really by you saying, oh, I'm on the blue side or I'm the red side. Your actions would tell us more about what side you are on. So this is something I would want us to like ruminate on. So the next question is, what is AMR? I don't want to assume everyone here has a deep understanding of what antimicrobial resistance is. Please, you permit me if I'm a little bit technical in my explanation. Antimicrobial resistance, in a very simple term, is when microorganisms, bacteria, germs, maybe E. coli, maybe staphylococcus aureus, any other microorganisms that we know of, when they have the ability to kind of survive in the presence of antimicrobials or antibiotics, maybe like that has once been effective on them. So when they have the ability to survive in the presence of antimicrobials that has once been effective on them, that has once been able to destroy them or inhibit their growth, then we can say antimicrobial resistance has occurred. And if you look at this slide critically that I'm showing you, you know there's one part, the left part is telling you antibiotic action, while the right part is telling you antibiotic resistance. So when it comes to the antibiotic action, I would briefly explain maybe one or two or three of these actions that helps antibiotics to function properly. For instance, we have what we call the cell wall synthesis inhibition. So when you take in an antibiotics, what happens is that the antibiotics work on the bacteria. So I'll give a vivid example. For instance, maybe I have diarrhea and I have to use tetracycline to treat my diarrhea, and I take in antibiotics. So the antibiotics wants to destroy that E. coli that is causing that diarrhea. And the way it goes about it is that every bacteria that we have, they have what we call a cell wall. And this cell wall is very, very essential because the cell wall has what we call a rigid peptidoglycan layer. And this layer has long sugar polymers, and this helps in creating a peptide bond. So what the antibiotics does is that it comes into the bacteria to attack this peptide bond, to attack the cell wall. And you know, when the cell wall of a bacteria is being attacked and destroyed, it automatically dies. So once that happens to the bacteria can no longer reproduce, and then its effect on the patient is being stopped. So that is how an antibiotics in the class of vancomycin, beta-lactamase classes of antibiotics, and cephalosporins, that is how they work, and they are being effective against these bacteria. Then another one I'll briefly talk about is the protein synthesis inhibition. So when you take in the antibiotics to kill that particular bacteria or to inhibit its growth, bacterial cells, they have a protein synthesis mechanism of action. So the protein synthesis helps in the production of nucleic acid. It's very, very essential because proteins are responsible for the structural composition, both the metabolic and also the physiological processes of an organism. So when these antibiotics comes in, for instance, we have chloramphenicol, tetracycline, linezolid. When they come in, they help to inhibit this protein synthesis so that the bacteria can no longer function properly. And when this happens, the bacteria dies or the growth is even inhibited. And then the last one is anti-metabolites. So this anti-metabolite synthesis inhibition. So what happens during this process is that some drugs that we have, like for instance, we have sulfonamides, they can act against important metabolic process like the folic acid metabolism. So they help to disrupt this metabolism process in the bacteria and lead to the death of the bacteria. So this is how antibiotics naturally work, to help kill and destroy bacteria that causes infection. So the next question is, how does antimicrobial resistance occur? So if you look at the right-hand side of the diagram, you can see things like efflux pumps. These efflux pumps, they are like a defense. You know, for those of us that watch football, you know, we have those that are the defenders and then the attackers. So they are like the defenders of the bacteria. So they help to like export any kind of antibiotics that wants to come into the bacteria to destroy it. So they are like efflux pumps made of proteins. So these efflux pumps, then they just kind of export antibiotics so that they're quite effective whenever we use them. So that is where antibiotic resistance comes in. Drugs like tetracycline, for instance, now no longer working effectively because the bacteria, for instance, maybe E. coli, maybe staphylococcus, maybe that this antibiotics work on, they've developed these efflux pumps that helps them to be able to resist the effect of antibiotics on them. What I'm trying to say with this point is that antibiotics are meant to work against bacteria, but they are no longer working against them because the bacteria are now develop a lot of mechanism to resist the effect of the antibiotics. And you could also read more on this later on. I would also briefly talk about antimicrobial resistant genes. These antimicrobial resistant genes, they are the genes in the bacteria that encode these mechanisms I earlier explained that helps the bacteria to be able to resist the effect of the antibiotics. And these genes can be present even in the environment. So these bacteria can transfer these genes from one bacteria to the other. So this could occur either through transduction, through transformation, or through conjugation. So these are the various means in which bacteria can exchange these genes between one another. For instance, bacteria, just like if you have a friend and you want to give the friend something and you are trying a means of exchange. So bacteria A can exchange it with bacteria B through the pilus. So that's what happens during conjugation. Or they could even take up free DNA in the environment that has this gene encoded in them. They could take it in and into their own chromosome, and then they have these genes that help to encode for this mechanism of resistance that I explained earlier. So this is the process called horizontal gene transfer of antimicrobial resistant genes. And you could also read more on that. I'm just trying to give you a scientific basis of how antimicrobial resistance occurs. This slide is showing the burden of AMR worldwide. So it's really a global health threat. As you could see from the left-hand side, this is the global death associated with bacterial antimicrobial resistance. And over 4.71 million deaths occur globally due to AMR-associated infections. And by 2050, it's projected that it's going to grow as high as 8.22 million, even though there are even projections that it could go higher than that. In the slide to my right, you could see that it says that 5 people die due to AMR in every 2 minutes. So even within the few minutes we spent here, some people have died due to AMR resistant infections. You can say it's really a global health burden. And even it's saying that 1.27 million people die each year due to AMR. So it's really a global burden that we need to address as early as possible. Next question that I would just like to ask, you could raise up your hand or type on the chat, anyone you want. If you were a superhero, and some of us have watched these fiction movies, what power would you use to stop the spread of superbugs, that is antimicrobial resistant bacteria in your community? Okay, Dauda, please, you can speak up.
Okay, thank you very much. I wanted to break the silence. This is quite tricky, and currently I know there's a lot of resources out there about antimicrobial resistance. So it's not about knowledge. There's a lot of resources out there already. So I'll not be a superhero that wants to make everyone know about antimicrobial resistance. So if I should be a superhero, probably I want to be someone with a magic wand. A superhero with a magic wand that will just wind the wand and make sure everybody have built behavioral change towards the use of antibiotics. So if you have people building behavioral changes, then there will be no need to rises of superbugs. And without superbugs, there will be no need to spread it. So it's not about telling people about the whole thing. It's about people building behavioral changes to how they use antibiotics, which in turn leads to no superbugs in our community, and there'll be nothing to spread. So if I should be a superhero, I'll have a magic wand and, wind the magic wand and everybody adopt behavioral changes. Thank you very much.
That's really brilliant. So if you have a magic wand, you just kind of change people's behavior so that they stop overusing or misusing antibiotics. Samuel.
Okay, thank you for giving me this opportunity. And being a superhero, I think you have this ability to do something great. So I think being a superhero in antimicrobial, I could manifest in having the ability to detect, I think, this bacteria and look for ways to neutralize them and the way they spread and they cause harm to individuals. Yeah.
Oh, great. Yeah, so if you're a superhero, you will look for a way to kind of just destroy all the bacteria so that they are not even able to hurt us. Although I would also like to point that there are beneficial bacteria that are beneficial to mankind. Not all bacteria are harmful. Henry said, I would first finish up the existing superbugs and then inject a fear to the community on the inappropriate use of antibiotics. Oh, that's also great. Those are very nice suggestions, and thank you all for your input. When we're talking of mitigating AMR, it's not just a one-size-fits-all. So it's a systems thinking. So in order to address the issue of AMR, it's not just, I'm going to do just one thing. it has to be like an holistic approach. It's going to be like a systems thinking to AMR mitigation. As you can see from this diagram, it's like weapons against AMR pathogens. So what are some of the weapons as a superhero, as like just jokingly, that you could use against AMR pathogens? And one of them is antimicrobial stewardship, which I'll be talking briefly about. Then another one is education and awareness, because at the end of the day, we can't also fade out the importance of educating people on the dangers of antibiotics misuse, how to discharge or dispose antibiotics properly. And, these things are very important. Awareness is also very important, just like we're also doing now, because when you don't know something, then how can you even take preventive measures? Then another aspect is the research and surveillance or using of the One Health approach, which I would also talk briefly on. Then we have a very important one, which is national action plans and policy, government regulations, government rules. For instance, in the US, there's the rule that you can't just go to a pharmacist or go into a pharmacy and say you want to get any drugs, not even antibiotics, except it's recommended by a doctor, and there has to be the doctor's prescription and all that. But in other low and middle income countries, it's not the case. Anybody can go and meet a pharmacist, go into the chemist, and then request for drugs. Another weapon is IPC measures, that's infection prevention and control, and WASH, that's water sanitation and hygiene measures, because by the time you're even preventing the infection, then there'll be no need to use the antibiotics. Then another measure that has been very effective in preventing disease spread is vaccination against resistant infections. Then we have alternative antimicrobial therapy, for instance, bacteriophages that people are currently developing. In the next slide. So looking at the One Health approach, I believe most of us are familiar with the One Health approach, but in case you are not familiar, so it's also a form of systems thinking that integrates the human, animal, and environmental health component to address the complex challenge of AMR. Because the truth is, it's not just about the human aspect. A lot of emphasis has been on the human aspect, the clinical settings, while the environmental aspect has been greatly ignored. And this is also very important in combating AMR. Then we have the animal aspect. Let's start with the human aspect. So for instance, when you go to the hospital, right, you go to the hospital maybe because you are sick and you expect to come out whole, like well and better improved in your health. But research has shown that sometimes when people go into the hospital, they acquire nosocomial or HAIs, hospital-acquired infections. For instance, Staphylococcus aureus is a vivid example of that. So imagine I go to the hospital, for instance, in Nigeria, and because they lack proper IPC measures, hospital facility is even dirty, there's a lot of spreading of bacteria all around, then I go to the hospital with a disease and I go back with maybe 10 more diseases. So that is what we call nosocomial transmission. We need to also focus attention on this through ensuring that our healthcare facilities have proper IPC measures that could help to mitigate the spread of these resistant infections. Research has shown that Staphylococcus aureus, for instance, can have a community-acquired methicillin-resistant Staphylococcus aureus, that's MASA. Some of us can be familiar with that term. This happens when the infection goes from the hospital and then starts spreading into the community. And this is where the human aspect comes in. And then we have outbreaks of antibiotic-resistant bacteria, like MASA is a very good example of this. If we want to mitigate AMR, we need to also focus on the clinical setting, the human aspect. What are the means of transmission and how can we break these transmission routes? Then the human misuse of antibiotics also indirectly leads to the animal misuse of antibiotics. For instance, if you look at most of our farms, people use antibiotics indiscriminately. They use it on their farm to boost the growth of their animals, and there's lack of IPC measures even on the farm. And through this, there's a need for more use of antibiotics. And when this antibiotics is being used, it's a cycle. We use the antibiotics on the animals, we end up eating those animals, right? And then it gets transferred to humans. So for instance, maybe there's some food that is not well properly cooked to even kill the bacteria. You consume them, you also kind of have infections that develop resistance to these antibiotics. And then the cycle continues. And then we have the environmental aspect, which is very essential. If you notice, both the human aspect and the animal aspect, they all dump everything in the environment. For instance, when you go to the hospital, the wastewater from the hospital gets discharged into the environment. The wastewater from the agricultural settings, livestock, fisheries, get discharged into the environment. And unfortunately for us in LMICs, where we have very poor wastewater treatment facilities. Wastewater is not well treated, discharged into our rivers, and we use that same rivers for irrigation and for other agricultural settings. And there's this spread of AMR in our community, in our environment. So this is just like a cycle showing us how the One Health approach works. So any step that we need to take to mitigate AMR needs to focus on both the human aspect, the animal aspect, and environmental aspect. So for instance, in LMICs, one of the things we are pushing for is surveillance of our wastewater treatment facilities, even point of discharge. We are also kind of telling the government that please, they need to improve the wastewater treatment facilities to be able to treat this wastewater adequately. So those are some of the measures that can be taken. Then also for the farmers, we need to enlighten them on when to use antibiotics on drugs. That is where the vet people come in, proper enlightenment, and talk to them about how to properly use infection prevention and control measures. So what is antimicrobial stewardship? Antimicrobial stewardship is a structured program that is being designed to promote the responsible use of antimicrobials. And this slide is basically showing you the very core elements of antimicrobial stewardship. And I will just allow you to read what is on the screen. I won't read it out to you because of our time. So some of these core components like we have is research, which is where you come in as early career researchers. We need research, we need surveillance, we need to educate our healthcare workers, educate our farmers, educate our community on, steps to take to mitigate AMR. Then also there's the need to prescribe antibiotics only when it is needed. And even after prescribing, people should ensure that they finish the course of the antibiotics so that the bacteria will not develop resistance against it. Then also IPC measures. So for the IPC measures, the IPC basically involves curtailing the spread of these infections, not just only in healthcare facilities, but also on the farm and in our community. And this includes wash activities like water, sanitation, and hygiene, access to clean water, access to sanitation facilities like good toilets where people can defecate, and water that is needed to flush the toilet and all of those things. So adequate sanitation facilities is very essential. Then hygiene, like hand hygiene, not only hand hygiene, cleaning of environmental surfaces, for instance, like eye touch surfaces. Then the goal of IPC is actually to prevent the susceptible patients and even farm animals from acquiring pathogens that could limit the spread of resistant infections. And this is very important because it's not just economically important, it's also important because it helps to keep us safe and even make healthcare affordable. These are some of the measures to combat AMR via IPC and hygiene, environmental cleaning. I did my MPH dissertation work on nosocomial infections in healthcare facilities and like how effective are the use of disinfectant. Do they even use it? And that was during COVID-19. There were a lot of pathogenic bacteria on environmental surfaces in hospitals. And even the disinfectant is not well used, or maybe they are not even using it in a standard way. And this has also led to nosocomial infections. Cleaning protocols is very essential, education and awareness, device removal for those that are health workers. The catheter, is it well removed immediately after use? Environmental cleaning, surveillance, and hygiene. Those are various IPC measures that could be helpful in combating AMR. The last slide I have here is capacity building against AMR, which is what we are currently doing now. It's very, very essential to build the capacity of the next generation. For instance, one of what we are doing in NACI is training. We believe in training, in mentorship. As you can see here, training, we are trying to train you within the next 4 months to be well equipped with the things that you need in carrying out your research, conducting surveillance, and you're contributing to mitigating the spread of AMR. Then also skills, like during the training, you would acquire several skills, bioinformatics skills, data analysis skills, communication skills, antimicrobial stewardship, mentorship. We are here to support you to create one-on-one mentorship avenues for you. Coaching is very essential. Capacity building is very essential because our ultimate goal is to raise leaders that are antimicrobial stewards and could help in the fight against antimicrobial resistance. So in conclusion, antimicrobial resistance is one of the most formidable challenges that is facing global public health. And it requires a coordinated systems-thinking approach, like I earlier described. And, embracing the One Health approach is very essential. IPC measures are very essential. Antimicrobial stewardship, they are all very essential in mitigating the spread of these resistant pathogens. And also capacity building, like what we are doing now, is very essential. And when we're talking of capacity building, we're also talking of an interdisciplinary collaboration. So it's not just the work of the medical doctors, it's also the work of the veterinarians, the animal scientists, microbiologists, the public health professional. We all need to work together, work hand in glove to be able to solve the problem of antimicrobial resistance. Thank you very much for listening, and I would give room for questions and answers. Over to my audience. By the way, these are my references. I have a question which I would want us to answer. What are some of the things that government can do in LMICs to help mitigate the spread of AMR?
Okay. I think the government can implement some of the policies that deter people from purchasing antibiotics from the pharmacies without doctors' prescription.
Christina, you want to say something? Please go ahead.
Yes, good afternoon, ma.
Good afternoon.
Thank you very much for the class. It was exciting. First, governments can actually step in by increasing or starting an awareness or increasing awareness, because I think I have not really heard about it on maybe different promotional channels like radio, like TV, on like how they publicize and create awareness for maybe cool educate health issue. I think government can create more awareness in this area, especially on antibiotics usage, so that people can stop misusing antibiotics and create an ethical system around it to curb this AMR. Thank you.
Thank you very much. That is very insightful. The government has a lot of work to do, especially in LMICs countries, low and middle income countries, because the rate at which people can just go over the counter and purchase antibiotics is very alarming. And you'll be surprised at what people use antibiotics for. Some believe that, it could help to prevent menstrual pain. The role of the government is very critical in raising awareness and also in ensuring that there's a lot of regulations going on. Dauda, you want to say something?
Okay, thank you very much. I think the government have a lot of role to play in mitigating the threat of antimicrobial resistance in LMICs. So as a Nigerian, I would like to limit my answer to Nigeria. I think that, there's some governing structure in the Nigerian health system for antimicrobial resistance and stewardship, but we need a more strengthened governing board. And I feel it's not so well. The impact of antimicrobial resistance, especially at the grassroots, is not being documented properly. Right? And we have limited testing facilities to test for the proper disease, which drug are to use for people, and like that. In my states, I stay in Sokoto State. I think we just have 2 testing facilities for antimicrobial resistance, which is, you have hundreds of thousands of people in the country, in the states, and you just have a proper 2 testing facilities for this large amount of individuals, which, it's also going to breed this improper diagnosis to use drugs for people. Aside from the fact that they need to also enforce the policies. Example, there are policies in advanced countries that they have this drug-free foods, where there are some foods that are free from antibiotics. We can also have them done in Nigeria, where we have some particular set of foods free from antibiotics. And the government can also prevent over-the-counter medication. Antibiotics are precious drugs, and they shouldn't be given without prescription. I know that every pharmacist in his or her training have been taught in school not to prescribe antibiotics over the counter. But because of the illegal practices we are used to in Nigeria, most pharmacists do, the policy is there, right? But most pharmacists do prescribe antibiotics over the counter, which comes to the fact that the government needs to enforce this law. There need to be sanctions for people that break these laws and the likes like that. And people don't know about antibiotic resistance like the way they know about malaria and other public health threats. So I think the government also have a huge role to invest in this issue. Let's it be on the mainstream channels like TVs, hold conferences that people will know and the likes like that. So I think these are the things that government can do. And then can also, I was speaking to a colleague of mine, I'm very excited this is taking long. I was speaking to a colleague of mine in school. In every university, I think this general course called GST, where they teach us introduction to English studies and probably French or Arabic, right? I feel antimicrobial resistance should be one of the general courses that has been taken in every institution. Basic things about how to use your drugs, how to prevent the resistance from occurring and like that. If we have every university, the government's putting in every university probably a module about antimicrobial resistance in this general studies course, then I feel it's going to increase the level of people, not just people in the health sciences, but every other person is knowing what antimicrobial resistance is and how they can fight it. So the government have a huge role to play, And I'm sure everybody has something to say in this. Thank you very much.
Yeah, thank you very much, Dauda, for that very insightful solutions that you raised. And yes, the government has a very huge role to play, and we also have huge roles to play. So that is why we are also building our capacity here so that we can go into our various communities to also like create more awareness. Maybe we have government workers or maybe some politicians as friends, policymakers as friends, or in our network. We could educate them more on this and encourage them to pass legislations and rules that could help in mitigating AMR, for instance, over the counter. Thank you very much. Shitu, you want to say something? I would also allow you to make your comment.
Hello, everyone. Good evening. My own opinion is the government, apart from the campaign and the awareness, which is very vital and very important, I think government has to come in some certain ways. One is kind of to subsidize the healthcare, because some few months ago in my school, going out for campaign, and we were talking to a shoemaker about antimicrobial resistance. He was like, what you are saying is good, but 2 weeks ago I went to the hospital, just few days of treatment, I was given a bill of over 20,000. It's so expensive for me. I'm just a shoemaker. So next time if I'm sick, I will not even bother myself going to the hospital again, just for me to get to a local chemist, and I'll get my drugs and get injection probably, and in a very cheap rate. So because of the high cost of hospital bills, people tend to go for the local ones without even without tests or anything. And secondly is the environmental. Before, they used to do environmental every Saturday, last Saturday of the month. Now they don't even do it again at all. I don't know. The only state I know I've heard of it again was in Bauchi every last Saturday, but it's not that effective just the way it was when we were very young. And when I'm going out in Benin here, I'm going out in the market, they dump their waste on the road, waiting for the waste management to come and pick them. Before they come, they are smelling this. Like, the waste management at all is very poor. So they have to kind of initiate that environmental again to make people know, to make people clean, because the best way to prevent antimicrobial is not to even get infected. And then the accessible water and clean water, they need to do boreholes for these local communities. They still go to the river to fetch water, and you tell them that don't fetch water from the river or don't fetch water from the well. They are not seeing that. They're like, where do you want me to get water from? I should be buying pure water. I don't have money for that. So they have to come in this to subsidize the healthcare, to enforce the environmental every monthly environmental. I can even make it maybe twice in a month, and provide clean water for the people. Thank you very much.
Yeah, thank you very much, Shitu, for those very valid points. Environmental aspect is also very, very essential. People just dump their waste. They don't even know how to dump antibiotics. Even maybe the ones they did not even finish using, they just dump it inside the trash and anywhere, which is also causing MR. And just like you said, the issue of strengthening our healthcare system is very, very essential. We have someone that will be coming to take us on that in some of our webinars ahead, and the person will be talking deeply about how can we strengthen our healthcare system in such a way that we have affordable healthcare for people. Because when people have easy access to healthcare, why would they go to the pharmacies to just go and buy unprescribed drugs? Thank you very much for those points. And what I just want us to have at the back of my mind is that, oh, fine, we are all talking about these issues, but the question is, what is the way out? How can we as individuals, how can we as professionals, how can we contribute meaningfully in mitigating this spread? Talking to your neighbor that is always using antibiotics anyhow, talk to them about the health effect and so on and so forth. Samuel said the government can enforce strict measures on antibiotic prescription, policies to reduce overuse and misuse, just like how I heard you talking of US government keeping restrictions to individuals purchasing antibiotics without doctor's prescription. Yes, these are also all valid points. Thank you very much. This was a very engaging section. Thank you. Bye.